Doctors of Reddit, what's your worst medical experience? I recently spent some time working in the operating department, and one day we had a giant inguinal hernia. At this point in my experience in the hospital, I thought nothing could surprise me. Dear Lord, was I wrong? The patient had mental health issues. We got him on the table, knocked him out with anesthetics, and pulled off his gown to take a look. His scrotum looked like an inflated volleyball. We did an open surgery through his abdomen and spent hours pulling his intestines out of his ball sack. Basically, the guy's abdominal wall broke through and allowed his intestines to slowly fill up his scrotum. This had been going on for years before he got it checked. This happened during an OB/GYN rotation. I was delivering my first baby. It was an older lady from the rural side of town. When I asked her to push as the baby had fully crowned, a wad of worms exited her anus. I gagged so hard but managed to keep a straight face throughout and deliver the baby. I realized then and there that OB/GYN was not for me. I interned in a city that gets very cold in the winter. Homeless people who were having a tough time surviving outdoors would come to the ED to get admitted, even if just overnight. They'd get a warm bed, a few hot meals, and a cleanup. This one fellow was in really rough shape and couldn't walk. The poor nurses did most of the cleanup, delousing, sponge bath, and dressing the open sores. My job was to do the physical exam, including the mandatory rectal. I literally had to lift that scrawny flap of a butt cheek and pick the encrusted dirt, feces, and matted hair away from the rectum to expose the anus. Thankfully, I only had to turn 180 degrees to reach the sink that I dry heaved into. But before this fellow can be discharged, he needs a podiatry consult. His black gnarled feet have thick yellow big toenails that have grown in a circle and are now piercing the bottom of the toe, the reason he can't walk. The podiatrist intern comes in, starts a foot soak, and proceeds to tackle those nails with something that can only be described as modified tin snips. Now you know how some people have that habit of opening their mouth when concentrating really hard? Yup, he clipped that nasty nail and it flipped right into his mouth. We shared the sink. Please like and subscribe for more videos like this. Thank you. A few years back, when I was a medical student, I was doing my primary care rotation when I had to see a morbidly obese lady for a gynecologic issue. She said she was having a lot of itching and soreness in her vagina. Even as I set up for a pelvic exam, I could already tell it wasn't going to be good. I could smell a foul odor already and I hadn't even looked. I was gloving up when I got so nauseated I was about to get sick. So I excused myself and lied to the attending physician that I had a problem taking a look at the patient and I didn't have much experience with such a challenge. The truth was I just couldn't stay in the room. It smelled like rotting vagina. A few minutes later, my attending calls for me to show me what he found. I thought for sure it would be an aborted fetus, but I was wrong. I go in with my mask and my attending dangles this cylindrical object covered with bloody debris. It was a freaking tampon. She apparently had difficulty removing it a week ago. My attending kept saying, "It f***ing stinks." The embarrassed patient was crying and I felt bad, but I had to step out of the room because I was starting to regurgitate my saliva and was about to puke. To this day, I can't forget that smell. It took a few weeks before I was able to go down on my girlfriend again. I think that was the deciding factor of me not going into OB/GYN. I just don't want to encounter the rotting vagina smell again ever. My dad is a doctor, an internal medicine physician. He told me the story of a young man in his late teens who came into the hospital with a question about a condition he was having. He said his pubic region was itchy and uncomfortable, so my dad asked him to remove his pants so he could try to identify the problem. Now, since the guy was African American, my dad had quite a reaction when the man pulled down his pants, and his pubic hair was white. It turns out the guy had gotten crabs from his lover, and the little bugs had laid microscopic eggs in his pubic hair, making it look white. The mental image still gives me the chills. I am a surgery resident. I once helped operate on a man whose face was chewed off by a bear. I had to find little scraps of skin at the edges of the hole in the middle of his face and try to decide where they went to try and make the damage smaller. Another patient came to the emergency department with a Barbie in their rectum. He apparently puts the arms up and legs down like in a diving position, rubber bands the arms together, and then places the doll in his rectum for a time. When he wants it out, he takes laxatives. Only this time, it got stuck. Here's the kicker. When we removed the doll, he asked for it back. Eye doctor here. I saw an NYPD officer years after his accident. He was shot in his Kevlar vest, which fragmented the bullet and ricocheted up through his cheek, traveled through his eye, exited the eye into the orbital bone sinus, and exploded off a part of his skull with brain matter. This disfigured man, even after reconstructive surgery, had a large hunk of cheek and skull missing and had a plate in his temple. The most shocking part of his examination was that he was completely healthy, just disfigured. He's cognitively normal. His vision was legitimately 20/20, and only some tiny bits of peripheral vision were lost. Looking into his eye, you could see the entry wound of the bullet fragment, the trail through the vitreous gel, which led directly to the exit wound. This thing must have been red hot because it cauterized the wounds going in and exiting. It was bananas, and 25 years later, still one of the most insane cases of survived trauma I have ever seen. I saw a man just after he was burned in a boiler explosion. His skin hung in strips off of his body, as if it had slipped off, like how easily the skin of a tomato slips off after it is boiled. Underneath was glistening pink and red flesh. The room smelled of cooked meat and mechanical grease. The poor man was aware and screamed in pain. It was terrible. I was doing my residency at a county hospital in Chicago about 25 years ago. My friend and I had a short break in between surgeries, and he went to the bathroom. I headed down the hallway to get a snack. After I got some chips, I went back and waited outside the bathroom for him. I waited 10 minutes and then went in. I found my friend's body on the floor with a large knife buried in his throat. A drug addict came into the bathroom and killed my friend to take his prescription pad to get more drugs. This was in rural Alabama. A middle-aged married couple came to the ER after they had been drinking for almost the entirety of the evening and got into an argument. Things got heated, and the woman eventually fell off the porch of their trailer into the shrubs a few feet below. The husband, in his drunken state, suddenly dropped the argument and came to his wife's aid. She didn't suffer anything too serious, just a couple of scratches here and there, except for what the man said looked like a piece of glass or pipe that became lodged in the woman's arm when she hit the ground. He decided to not come to the hospital because he could remove this object himself. He got his largest pair of pliers and gripped onto this glass/pipe-looking thing lodged in his helpless wife's arm. He clamped down and pulled, cranked and cranked, trying to remove this object. It still wouldn't budge. After his masculinity was defeated and the alcohol started to wear off on both of them, they decided it's sensible to finally come to the ER. Upon arriving at the ER, the doctor immediately realized this poor woman had a compound fracture of her humerus, and this pipe or piece of glass thing was her bone sticking through her skin that her husband was trying to pry out with a pair of pliers. A child came to the hospital with cigarette burns dotting his torso. Almost every patch of skin that could be covered with a t-shirt was scarred. Some of the marks were old, some were very fresh. His parents said it was a skin condition. A young woman who got pregnant started having headaches so bad she would go blind at times. She was 8 months along when she had a shielded CT due to other neurological presentations. Turned out to be a massive brain tumor. They did her C-section and craniotomy at 38 weeks. The mom was a vegetable, didn't know she had a baby, and had the remaining functions of a 3-year-old. I'll never forget the time the family brought the baby, now a few months old. The mom was on our unit for chemotherapy side effects, and the baby was just laying on her, crying its head off as the mom watched kids' cartoons. She had no acknowledgement or any reaction to the baby, nothing at all. A drunk guy was fighting with his girlfriend and decides to light up some firecrackers and throw them at her. Well, he waits too long after lighting one and ends up blowing off his hand. He's brought to the ED, completely drunk and having lost a lot of blood. We stabilize him and take him to the OR. While the hand surgeons are cleaning off his stump of a hand, me and the surgery resident are fixing all his chest wounds. One of the hand surgeons says, "This is a mess. Did anyone at the scene find his thumb?" No one knows. We continue examining, cleaning, and suturing his wounds, and lo and behold, buried in a deep wound in his upper abdomen is 2/3 of the guy's thumb. If he hadn't been so fat, his thumb would have likely entered his peritoneum. I worked in a psych unit. One of my patients smuggled in a razor in the spine of a book and committed suicide by flaying his arms from wrist to shoulder. Another chased a handful of Percocet with about a liter of vodka, set herself on fire, and then jumped out a window. Neither survived. Doctor here. I was working in the ER one evening when I had my worst experience so far. I was called to one of the examination rooms that are designated for infectious patients. This is already a bad sign, as it usually involves some sort of abscess that needs to be drained. However, this time it was far worse. I was told by the nurse that it involved a man who had bilateral venous ulcers on his legs, and that they were now infected. I looked through his journal and saw that he last saw a doctor about 10 months earlier and no note of any checkups after, not by a nurse or a GP. I asked my nurse when someone last took a look at his legs. Not since his last journal entry. Then I asked when was the last time he changed his dressings on the legs. She said, he hasn't. Here's some background info on this patient. He's an old man who lived by himself in his trailer that was parked in the middle of the forest. He had no running water. He was a drinker and had an I don't give a shit mentality. I suited up and went into the room. The room smelled like an odd combination of stale beer, mold, and disease. Certain infections smelled different, and this one was very pungent, almost sulfuric. I introduced myself to the patient, who didn't understand what he was doing there. All he wanted was some antibiotics for a flu, and then he was sent here. Why the f*** do you want to look at my legs? They were already taken care of last year. The nurses and I started unfolding the dressing. They were crusty and crackled as we unwrapped the first leg. As we got deeper, it changed color to some sickly yellow, and the stench became worse and worse. One of my nurses left the room to throw up. Then I saw it. Inside a fold, there was a little maggot that squirmed. When we finally got to the wound, we saw all the little maggots feasting on this man. There must have been 50 of them. The stench was absurd. I was focusing a lot to breathe through my mouth, but then it felt like I could taste it, which made it even worse. My nurse came back and promptly went out again. I unwrapped his other leg, and it was the same story there, but the infection was much deeper, and I could see a few tendons on the base of the ulcer. We had to clean off the maggots and place them in a bowl, but they were squirming and went on the floor and crawled all over the place. I had to watch my feet so I didn't step on them. After that, we took the patient to hose him down to at least try to get rid of some of the smell, then booked him to the OR for debridement and a fresh vacuum dressing. He was discharged a few days later with strict instructions and booked him in to return for redressings and checkups. We never heard from him again. During my final year as a med student, I was observing a pediatric cardiac surgery on a young infant girl who had been having recurring problems with breathing. Investigations showed that she had a heart defect. However, when she was opened at surgery, they realized that her condition was more extensive and complex than expected. Her multiple heart defects would make it difficult, if not impossible, to operate on her without causing more harm than good. I remember seeing the surgeon just looking at her for a long time, seemingly analyzing the situation in silence. After about 5 minutes or so, he just shook his head and started closing up. I never found out what happened to the little girl afterward, but that event stuck with me since then. I once had a patient who had a history of multiple suicide attempts and self-harming. He drank caustic cleaning chemicals which damaged his ability to speak and swallow. He had problems communicating and had a G-tube for nutrition. He had a urine bag because he had damaged his urethra and bladder with knitting needles and chemicals. He was severely scarred over his whole body after attempting to immolate himself with gasoline, which also left him with several amputations. He was in the VA system, and I knew him over the course of many years. It was always distressing to interact with him. I couldn't satisfy his neediness, which he constantly demanded that I do. I was assisting in a crash C-section once. The mother was eclamptic, sky-high blood pressure, and the only cure is to deliver the baby, but she was only 25 weeks. Everything happened so fast that there was no time to get an epidural, so we had to put her under general anesthesia. The baby had a strong and healthy heartbeat, but of course, once you deliver at 25 weeks, that really doesn't matter. The father sat in recovery beside his wife's stretcher holding their dying baby. The whole time, tears just kept running down his face. He never said anything. He just sat, without talking, holding a tiny bundle of blankets, looking down at a perfectly formed tiny face struggling to breathe. The mother was still sedated, but when I walked in, the father had the bundle in one arm and was holding the hand of the mother with his other hand. He was humming a lullaby. He just held and held the baby until he died in his arms, never saying a word, just rocking it back and forth, humming to him, crying the whole time. Thank you for watching, and please subscribe to my channel for more Reddit stories. This is Reddit Story Hour. See you in the next video.